So there are different phenotypes of obesity, which means there's this disease. There's so many pathways our body uses to regulate our weight and hunger, and there's different manifestations of this. And there's a researcher who really has delved into this for several years, and what he noticed is pharma- pharmacological treatment should be aimed at the phenotype to improve outcomes. So, contrary to popular belief, not everybody should be on semaglutide or tirzepatide. So, whenever you do an intake with me, I'm going to ask you about your hunger patterns, emotional eating tendencies like energy levels, stress, sleep, underlying metabolic conditions. Okay, and then of course, what you want to do. We'll talk about that. But it's personalized. And I'm going to go over the different treatments and kind of how I decide what to recommend. Okay, so let's start with the big boys, semaglutide and tirzepatide. Everybody's heard about them at this point. This is a weekly subcutaneous injection. There is an oral semaglutide. It's okay. But it's a peptide, so injections are really best. So this is kind of best for those who have hungry brain or hungry gut. Best for those who eat large meals. So they need help with like portion control because they may not feel hunger or satiation. Their GLP-1 has been suppressed. They're leptin resistant, so they don't feel full. So they can eat large meals. So this will help. It slows the gastric emptying and it helps those satiation hormones, the GLP-1, connect to the receptors. So it replaces those kind of. Okay, so it could also be beneficial for those with insulin or glucose dysregulation, like prediabetes, diabetes, PCOS, because it tells your liver, hey, don't produce your own glucagon or sugar. Don't produce your own sugar. And it tells your pancreas, hey, let the insulin go, okay? So that's how it can kind of help that. It may be beneficial for those who feel hungry like soon after eating, like they eat a normal meal and then 30 minutes later they're starving. It can really help with that. It can also help, it's been beneficial, it can decrease inflammation, so help with heart problems or autoimmune disorders, which is fascinating in and of itself. Has side effects, GI side effects mostly, especially semaglutide with the nausea, tirzepatide with the constipation, vivid dreams, all sorts of weird things. Okay, liraglutide, which is Saxenda, which is now generic. Um, this one is a daily injection, not as powerful as semaglutide, so its weight loss effects are less, but it's for those who again need some appetite control, but maybe like a daily reinforcement. Okay, may be helpful for emotional eaters as it can help regulate your appetite more consistently throughout the day. Buprenorphine. Bu- I can't say it. Wellbutrin, okay? Wellbutrin. Okay, so this one is, it can help increase your energy. It can help with depression and anxiety. It can also cause anxiety as a side effect too, so be careful. And it can help with emotional eating. It increases your dopamine and your norepinephrine, so it boosts motivation. It can boost your mood. It can cause some insomnia. Okay, so it may be beneficial for those who gain weight due to like lack of sleep or grief or stress, or those who have low energy and can't take phentermine. So a low resting metabolic rate. Those who are tired all the time. This might be beneficial for those people. It's usually and often coupled with naltrexone as a medication called Contrave. And again, naltrexone, you guys, opioid people who have overdosed on opioids, like we give them Narcan, it's an opioid receptor antagonist, which means it can counteract those opioids. So if you're on opioids for pain medicine, this is not for you because it'll make that pain medicine not work. Okay? But this can help with emotional eaters, those with food addiction tendency, those who feel compelled to eat for pleasure or reward. Again, it's often combined with Wellbutrin, because I can't pronounce that. So that has a synergistic effect whenever you combine those two. Now, this one, naltrexone, can cause some nausea. I'm just saying. Topiramate, which is, anticonvulsant or anti-migraine. This can be very helpful for those with binge eating disorder, who eat large meals, particularly at night, because it has some appetite suppressing effects. Again, it may help with those who gain weight due to, stress, lack of sleep, as it can reduce those stress-related cravings or those impulses. So that one is a great one. Metformin, oldie goodie, cheapie. Modest weight loss with this, or modest to none, but it does help improve insulin resistance, PCOS, or metabolic syndrome. And if you can improve your insulin resistance before you start semaglutide or tirzepatide, that may be very, very, very beneficial in the long run. Because we know people with diabetes who take semaglutide or tirzepatide have less favorable outcomes, or mean they lose less weight than those without it. So if you can get ahead of that before starting semaglutide or tirzepatide, that may be beneficial to you. Either you can maybe consider metformin, consider a reduced energy dietary plan before starting semaglutide. There's several things you can do to get that better before you start semaglutide. Low dose naltrexone. How this can help, it's usually an add-on, but it can help with chronic inflammation, autoimmune conditions, those who've gained weight for stress or poor sleep. Also a good option, those with GI issues like a gastroparesis, and maybe you cannot take semaglutide or tirzepatide because of that. It can help regulate gut function, reduce inflammation. So maybe people with, Crohn's disease, those inflammatory kind of, autoimmune-ish GI-related problems. Low-dose naltrexone may be very helpful. I didn't put phentermine on there because I only have phentermine available in Oklahoma because DEA regulations. But phentermine, oldie, goodie, cheapie, wonderful medication. I know it's FDA approved for short term. People who are physicians, nurse practitioners, physician's assistants who are knowledgeable realizes that is a bias. I mean, we prescribe kids Adderall for their whole life, but we can't give phentermine for more than 3 months. It doesn't make any sense. There's many studies showing long-term safety. Phentermine, great medicine, cheap medicine, can cause some palpitations, some cardiac, increased blood pressure. So there are precautions. It is a stimulant. You may have a false positive on a blood test. I think topiramate you can have a false positive too, but I'm not sure. Somewhere in the back of my mind that's running around there. Okay, so there's more than just semaglutide. And yes, some of these have a more mild or modest weight loss, but for you, it may be significant. This may be exactly what you need. It's cheaper, it's more accessible. Insurances pay for Wellbutrin, which is ridiculous. Anyway, liraglutide is now generic. While it's still a stupid amount of money, it is generic now. Semaglutide, I heard Wegovy just started like a $400 a month cash pay. You could get that. Tirzepatide, Eli Lilly has vials. They're still stupid expensive, but up to 5 milligrams, it's kind of within budget. So we can prescribe you the Eli Lilly vials if you need it. There's more things that we can do. Okay, we can add on adjunct. It's all personalized. So if your healthcare provider isn't personalized your treatment, then then maybe you should seek out somebody who is knowledgeable. Go to the Obesity Medicine Association. There you can search by provider, and you can find a provider in your area. Okay? Whoops, I did that wrong. There, let's see if I can shut her off now.